Good morning, Ivan. Thank you very much for taking the time. You're one of our 5 lecturers that will be giving lectures at the 2025 Shiatsu Summit in Vienna. First question: what is your personal connection and your approach?
But what you have to figure out as a practitioner is what kind of fatigue we are talking about. So mostly it's there is several layers, if I can say. So it's several layers of fatigue. The most common one is lung fatigue when someone is having a hard day, working too much, maybe doing a lot of sport, this kind of thing. So you have a good rest in the night and then it's better. Second one is the spleen one. Spleen is a bit deeper already. It's touching, of course, the food you're eating, also the rest you're having, and the thoughts and the blood. So it's a long process already to cure someone if we can help him or her to balance the situation. It's already a long work, but you can have stronger things like heart fatigue, kidney fatigue, and liver fatigue. So there is a kind of chronology of fatigue that is going to go deeper and deeper in the body. And every time if you do understand where is the problem and how far is the person in this fatigue, then you can help the person. About depression, unfortunately, as you know, we have so many people struggling with this problem, and there is different kind of depression. We can talk about postpartum depression for women after giving birth. We can talk about seasonal, like in autumn or winter. Seasonal depression is something that's happening a lot also, and so from time to time also you have this major depression syndrome, which is very bad, a nasty one. And the last thing I can talk about is burnout. Burnout, unfortunately, I've been through it, and it's a very tough situation to live. And this helps me, if I can say so. It's I can talk about my own experience. I'm talking from the inside, if you want, and it's a really hard thing. So we tend to mix them all. That's one aspect, but we should not. Especially, usually I'm explaining in my workshops that depression and burnout usually are, especially by doctors, they are more or less considered like the same thing, but it's completely the opposite. If you're not talking to people, but just observing the people and their reaction and their body and the level of fatigue, well, there is a huge difference between those two. One aspect for depression is really interesting. Someone who is depressed has energy, but doesn't want to go to work. And someone who is in burnout has no energy, but really wants to go back to work. So you see, just with these two sentences, you can see the whole difference between the two.
Hmm. Very interesting. Very interesting. And you talked about the chronic fatigue now, and about the depression, and about the burnout. What will you be focusing on in the run of the summit, and what can people expect when going to your workshop?
Well, normally I'm the one who will teach about burnout during this workshop. So first thing from my point of view, that really can help people to understand how to treat this problem is to go through one of the many different theories of Chinese medicine, which is the 6 layers. 6 layers is really interesting because you can um, consider a human body like a bucket, like a bucket with layers inside. And unfortunately, this bucket has a lot of holes. So your energy is going out and going out. So first things is to find where are the holes in the bucket and to fill them. Then after to replenish all the layers one by one. So that's why it's so important to understand this system. If you consider this human body like a bucket, it's funny and a very convenient system. but it works. It works because I've been treating something like, I don't know, 300 or 400 people like this, and it's always working. It takes time, of course, and it takes time depending of the situation. What kind of burnout, again, are we talking about? If it's mostly, I'm talking about three different situations. One is the person who is walking straight to a cliff, and if you do nothing, this person is going to fall. So your job is to stop the person, grab her and or him, and say, "Oh, don't go this direction. It's really bad for you." Okay. The second step, it will be the people who got the all the toes of their feet in the void in this. They can really fall. This is a bit tricky because you have to be able to take them back, but very gently and cautiously, because otherwise you can also push them. And it's a very delicate moment in this burnout situation. And then the last step is, unfortunately, for the people who are already fall, and you have to take care of them. And this is a long process. So I'm giving some pictures like that to help the students to understand where are we in the process of the burnout and what you have to do in these different steps of the burnout. Of course, the last one is taking more work to do, but in a way, it's a good client, if I must say. It's going to take minimum 1 year of treatment. And the six layers is telling you, okay, this layer has been affected. So usually Taeyong is already dead for a long time ago. And then you go to Shaoyang and then Yangming. And usually burnout starts when you start to attack the yin layers. So immediately you are in Taiyin, then you have Jueyin, and finally the last layer is Shaoyin. And when you are on Shaoyin, as you know, it's heart and kidneys, which are two vital organs. So it's very serious.
Okay, thank you. And you mentioned that you have your own personal experience with this topic. When you were through it yourself, did you already do shiatsu? Could you see from that point of view while you were in the middle of the process, or was it before your shiatsu life?
No, it was right at the beginning, in fact, of my shiatsu life. I was not aware enough of the different kind of problems I was facing, especially working too much, doing 8 hours, 9 hours of shiatsu every day, 6.5 days per week. And it was way too much. I was also leading a brand new school with a lot of students. And I was writing already on my blog and so on and so on, many projects on the side. So at one point, it was really too much. And what was good for me is the ability to understand, okay, now I have to apply to myself all the tools I know. So I start exactly the same way I'm teaching now. I start to take care of myself layer by layer, and also in parallel to change my food, my habits of doing things, slow down, working in the forest, having a lot of rest, using qigong, uh, all the tools that we usually talk about. But when you have to apply it to yourself, well, that's a different story. But in the end, it works. So you can say, okay, now I've got the experience of this problem.
We like to give advice, but sometimes it can be a challenge to take your own pill, right?
It is indeed. Just for you to know that the average of time for someone who is in this situation is 1 year, 1.5 years for the first burnout. I was able to recover in 7 months.
Mm-hmm.
So you see, it's really important to know all these details.
Certainly. All right. So one last question I have for you. What are you most looking for when coming to Vienna? What are you most looking forward to?
Kaiserkreine?
Okay. I wasn't expecting that. That's a good one. That's a good
No,
one.
seriously, I'm really hoping to find a lot of people who are really involved in this Shiatsu learning about this specific topics we are going to go through during the workshops, chronic fatigue, depression, and burnout, but also to find some people who are interesting to go further than just the the symptoms, the way to fix it, and so on. Some people who are really challenging themselves in order to go further in their own development or as a therapist. That's what I want and what I like usually in these meetings is the ability to meet new people and listening some stories. That's always a very human friendly moment, all
Yeah.
these summits. Yeah. So that's what I'm expecting.
Okay. Thank you very much indeed for taking the time. I'm looking forward to soon seeing you in Vienna. And have a good day. Thank you.